I'm here for an appointment with Monty.
Oh, good morning. Go ahead and sign on in.
Okay, and then I have my paperwork too. You guys emailed it to me and I filled it out.
Thank you. It looks like you have your paperwork all filled out. Your insurance is verified. Go ahead and have a seat, and Monty will be right with you.
All right, thank you. Hi.
Hi, I'm Monty Merrill. It's nice to meet you.
Nice to meet you.
Good, good. I'll be your physical therapist.
Awesome.
So come right up back here.
Okay.
Here.
Okay.
You can have a seat in the comfy chair there.
Awesome.
I'm going to ask you a bunch of questions here.
Okay.
Good. All right. So I see you're athletic. What kind of sports do you do?
Right now I just do CrossFit. So
Okay.
just lifting, running. I'll go to the gym and do my own workouts too.
Okay, good, good.
That's the hard
All
part.
right. How did you hurt your neck?
I'm not really sure. It's kind of a reoccurring thing. It's the left side and it kind of starts in my trap, shoulder blade area, and then it just radiates up and I get these really bad headaches. Yeah.
Okay. How often do you get your headaches?
At least probably once a week.
Okay.
And they last all day, sometimes even through the night to the next morning.
Where do they start?
It feels like it starts more right in here, and then I can feel it just moving up. And it's a little bit tender if you touch back here.
So it starts right back here and then moves right up into here.
Yeah.
Okay, great. Your posture.
Okay.
So I can see your left shoulder's up a little bit,
Okay.
and you can see this tightness right in through here.
Can you?
Yeah. Okay. And have you looked? How is it if you look up at the ceiling? Does that bother you?
Not really.
Okay. How about turning over to the left?
I feel it's a little bit tight
Whereabouts?
right in here.
Same place.
Mhm.
Okay. How about going to the right?
That feels fine.
Not as
I feel a
bad.
little extra pull here,
Okay.
but it doesn't hurt on the right.
Okay, good. And that looks a little cleaner going over that way.
Okay.
How about bring your arms up? Any problem with that?
It just kind of aggravates my headache a little bit.
Okay, on that left side? Okay. Good. Again, coming from here up?
Right.
Okay. Good. I want to just check your reflexes real quickly and make sure your nervous system is good.
Okay.
And let's see. I'm going to have you lying on your back on the table here.
Okay.
Put a pillow under your knees for you here.
All right.
Good. Let me know if any of this hurts you too.
Okay.
What I want to do is I want to find your limitations, but I don't want to create any more problems.
Okay.
Is that where you get your headache, right up there?
Yeah, right in there.
And right there?
Yeah, that's
Okay.
actually a little tender.
Yeah. And I can feel that. That's a joint.
Okay.
So that's one thing that's aggravated. And as I test your movement here, that gets a little stiff.
Okay.
Okay.
Do a magazine to read or anything?
Pardon?
Want a
And
magazine?
you feel, yeah, so you have a stiff joint right up here.
Okay.
And you have that spasm of ropey muscle that runs right from the base of the skull right down to the top of your shoulder blade.
Yeah.
And that's who's aggravated there.
Mm-hmm. That makes sense.
Good. How are you doing so far?
I'm doing good. It makes a lot more sense now.
Okay, good. You may be a little bit sore after checking and seeing what you can do, what you can't do.
Okay.
I'll have you ice at home with that as well.
Okay.
But what I found that joint right up here is stuck. It's a little stiff. We're going to get that moving.
Okay.
We'll also take care of this muscle coming up in here. What I also want to do is I want to take a look at your lifting, and I want to take a look at your pushing and pulling, and especially some of your overhead lifts,
Okay.
your head and neck position,
Mhm.
because that'll be key in making sure this doesn't just keep coming back.
Right.
And if you have questions, please ask. Or if we're missing anything, let me know.
What are things that I should avoid doing for now?
Right now, if you're doing your snatches and your cleans, that will be, let's hold off on those until we get this cleaned up in here.
Okay.
And I want to make sure you don't have a headache for a couple days before that comes in.
Yeah.
And then we'll work on cleaning that up with your head and neck position.
Okay. What can I do at home to kind of help get it moving?
Great. I have, one thing I'll have you doing is working on your sitting nice and tall here, coming up. You can use ice up in this area,
Okay.
and you can also do the stretches and the 2 exercises that we just went over previous to this.
Okay. Awesome.
Good. Do you have any other questions for me?
Nope. So far, that's it.
Good. Any concerns?
No, I just really just don't want headaches anymore.
Exactly. Good. So what we'll do, we'll do some work in here. We'll do some soft tissue work. We'll work on getting the joints moving.
Okay.
We'll also work on exercising out in the gym, getting your strength and your stability up. I have your home exercise planned out for you, and our goal is to get you back lifting and being able to study and work without your symptoms.
Awesome.
Good. And this kind of thing, this will take 2 to 3 weeks to make a lasting change.
Okay.
You'll feel better on the first couple times as you get that joint moving.
Mm-hmm.
But give us a little time. With ligaments and tissues like this tend to be a little bit of a slow healer, so
Okay.
it may take a couple weeks.
Okay, that's good to know.
Good.
All right.
All right. So what we'll do is we'll take you up front, and then Stacy will get you scheduled, and we'll get the times that you need, and I look forward to working with you.
Awesome. Thank you so much.
Thanks.